Violum. I'm Caitlin. I'll be your nurse this afternoon until 7 o'clock tonight. What brought you to the hospital today?
Having a really hard time breathing.
Okay. What started this?
Started in the middle of a lacrosse game 2 hours ago. Got hit pretty hard with some sticks and just had a really hard time breathing since then.
Okay. You got a direct hit from a lacrosse stick?
Yeah, right in the back.
Okay. And you've been had shortness of breath ever since?
Yeah, and a lot of pain too.
Okay.
Yeah.
Can you rate your pain for me on a scale of 1 to 10? 1 being no pain and 10 being the worst pain of all?
I'd say 5 or 6.
Okay. Does that 5 or 6 increase when you breathe in and out, or does it stay 5 or 6 no matter how you're breathing?
It's about a 7 if I take a really big breath in.
Okay. Do you have any medical history I should know about?
No. Pretty healthy, don't have any problems. I don't take any medications or anything.
Okay, and do you have any allergies to medication?
No.
No? And did you take any medications before you arrived to the ED?
Yeah, I took a couple ibuprofen.
Okay, good. So right now I'm just going to take a listen to your heart and lungs, and then the doctor's going to come in shortly, okay?
Okay.
Do you mind taking off your jersey so I can examine?
Yeah.
You have a pretty bad bruise right there.
Yeah, it's hitting me.
Okay. So right now I'm just going to listen to your heart, okay?
Okay.
You can just breathe normally. So listen around your aortic area, the pulmonic area, tricuspid area, and your mitral valve area. I'm just going to listen to your apical pulse for about a minute, okay? After a minute of listening, it sounds like your heartbeat is pretty fast. Maybe, I think it sounds like it's about 130. Do you usually have tachycardia? Have you ever been told that you have a high heart rate?
No.
No? I noticed that you're also breathing really heavy and pretty fast.
Yeah.
Okay. I'm just going to finish my cardiac exam, okay?
Okay.
Do you mind looking towards the window for me? Alright, I'm just going to listen for any bruise or thrills on your cardiac arteries, okay? Your carotid arteries. Can you hold your breath for me? Alright, you can breathe again. Alright, do you mind looking towards the office door? Hold your breath. Alright, you can breathe again. I'm just going to check for jugular vein distension, okay? Alright. I'm just going to go for your pulse, okay? Wonderful. I'm going to fill both your radial pulses. Yeah, your heart beating's pretty fast.
Yeah, I felt like it ever since. I thought it might have been just because I was running around, but...
I'm going to check the fetal pulses while we're doing that.
Okay.
Nice fetal. Okay. May I see your fingers? I'm just going to check capillary results. Very good. All right. So on your heart assessment, your cardiovascular assessment, I noticed that you have normal heart sounds. I can hear S1, S2, which is the lub-dub sound that everyone says you can hear. I did not hear an S3 or an S4, which that's a good sign. You do have a little jugular vein distension, but when the doctor comes in, he's going to look at that as well to determine what may be causing that. Okay? So right now I'm just going to listen to your anterior lung fills. Okay? you try to take some deep breaths? I know it's painful, I'm sorry. Alright, do you mind turning around for me? So right now I'm just going to check for equal expansion on both sides, okay? Just come a little bit towards me. There you go. Take a nice deep breath. And one more. Alright, it seems that you have asymmetrical chest expansion, lung expansion, which is not normal. But I'm going to continue my assessment and see what else I find, okay? So right now you're going to feel my hands on you doing something called checking for tactile primitus. And what I want you to do is every time you feel my hands on your back, just say 99, okay? All right?
99, 99, 99, 99.
Okay. On your right side, I've noted that you have some decreased tactile primitus, which could mean that you have fluid or air in your lungs. Both of those are abnormal, but they can mean different things. So I'm going to go ahead and percuss, which means just tapping on your back, which will give me a better idea of whether or not you have air or fluid in your lung, okay?
Okay.
So a little light tapping. If there's air or fluid, it's going to sound different than a normal. Alright, so you have some hyperresonance on your right side. As I suspected, you probably have a little bit of air in your lung. Most likely it's from getting hit with that lacrosse stick, okay? So I'm going to go ahead and listen to your lung fields on your back, okay?
Could that air be causing my problems breathing?
It can. So the reason why you would have air in that space is you have a collapsed lung, most likely from the blow you took to your side. And the air is between the collapsed lung and your chest cavity, or chest wall cavity. Very good. All right. Very good breath. All right, so right now I'm just going to have you say E every time that you hear my stethoscope, okay?
E, 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 E.
Okay, you have normal egophony. Now, I just want you to say 1, 2, 3, 4 and whisper it to me when you hear my stethoscope, okay?
1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
All right, very good. You can go ahead and turn around. I know that's painful, I'm sorry.
Could you hear anything in my lungs, or?
So, the right side of your lungs, so normally you should have equal chest rise and fall, and you should have equal and bilateral lung sounds in all fills. On your assessment, I found that you have decreased lung sounds on your right side, which can tell me that can also lead to maybe having air in your lungs. Although decreased breath sounds can be caused by many different things. After having your JVD that I discovered on your heart assessment, hyperresonance, decreased tactile primitus, and then also having a decreased lung sound, makes me believe that you might have a pneumothorax in that lung. And that's mostly seen in skinny, white, athletic young males.
Okay.
I know that doesn't make you feel any better, but we do treat that often. So when the doctor comes in, he'll probably order a chest x-ray, and then you may or may not need a chest tube or need some decompression if there's just air in there. But he'll go through everything with you, and we'll talk you through everything, okay? Do you have any more questions?
Is there a chance that I may not need a chest tube, or like will
Sure.
this go away, or?
Sometimes people will have pneumothoraxes and not know it sometimes, And then other times they'll come in like you did with shortness of breath and trouble breathing. We'll have some JVD. And depending on how large the pneumothorax is whether or not we're going to put the chest tube in.
Okay.
So if you have a really small one, we might watch it overnight to make sure it doesn't get any bigger. Sometimes it doesn't go away for 12 hours, and sometimes it'll last for months. But then with larger ones, we can decompress it with a needle decompression, and then other times we might have to put a chest tube in for 1 night or 2 nights and just drain the air and fluid. But we'll talk you through everything, okay?
Thank you. Thank you.
Mm-hmm.
You've been great. Thank you.
All right. It was nice to meet you.
Nice to meet you.
Mm-hmm. Hey, Mr. Milam. How are you feeling?
Oh, about the same.
Yeah. You seem like you're still having shortness of breath. And
Yeah.
what's your pain level now? 1 being the no pain at all, and 10 being the worst pain ever?
It's a little bit better. Like maybe 4 or 5 now.
Okay. I know one of the other nurses came in and gave you some pain medicine.
Yeah.
Has that been helping?
Yeah, it's helping a little bit.
Okay. Is there anything else that makes the pain worse or makes it better?
The deep breaths still make it pain worse. Yeah.
Okay. And Dr. Davis has already come in to examine you, and you had your chest x-ray, right?
Yeah. Mm-hmm.
Okay. Do you have any questions for me about the findings?
Yeah, I don't really. My mom called, and I couldn't really explain to her. I forgot what he said about the chest X-ray. Do you mind?
Sure. So the chest X-ray just showed that you had a 70% pneumothorax, which is a pretty big pneumothorax.
Okay.
So based on that, and you're still having, increased shortness of breath, you're still kind of tachycardic on the monitor, and your blood pressure, normal systolic blood pressure is 80 to 120, and it's starting to trend lower. So right now it's 92 over 60, and for that reason, and the reason that we're going to have to place the chest tube in for that 70% pneumothorax, we're probably going to admit you to the ICU overnight and just monitor you. You might go out tomorrow morning or maybe tomorrow afternoon. We're going to do another chest x-ray in the morning and see if the chest tube has actually helped.
Okay. All
right. Do you have any more questions for me?
Is the chest tube painful? Does that hurt?
It is a little bit painful when it goes in, just because the needle's pretty long just to get into the cavity. But there is lidocaine that we administer first. The doctor will come in and give you some lidocaine, some too, so that will help that area. And we also can give you some more pain medicine to help you relax, okay?
Okay, all right. Thank you.
All right, anything else?
I don't think so, thank you.
All right, I'll be right back, okay?
Okay.